Well, in a demonstration of exactly how the COVID-19 crisis here in Niagara is fluid, it's always changing. We had plans to talk with Jim Bradley today about other things, obviously related to the COVID-19 crisis, but just recently it's come through that the Niagara region, along with all 12 municipalities, has declared an official state of emergency. So that's going to be obviously the focus of most of what we talk to the regional chair about. Jim, welcome.
Good to be with you under these very trying circumstances for all of us.
Jim, this is not a decision that is approached lightly. It did involve cooperation from all 12 municipalities, from the mayors and the regional councillors. How did this come about?
Well, this came about largely because we've been discussing for some time more when we would declare an emergency rather than if we would, and it wanted to be at the appropriate time. We know it's imperative that the actions we take over the next number of weeks are really going to determine how Niagara does in helping to bend that curve and how we fare with the COVID-19 pandemic. It's really essential that we do it. And so we, as mayors and regional chair, have discussed this a couple of weeks now. We decided this was the appropriate time for a couple of reasons, Mike. The first is that we're going to get some news out of Ontario today at just how drastic the situation could be, how serious it will be, some of the projections as to how many people will acquire the disease and how many people will perish from it. So it's very important that we make this message clear to people at this particular point in time. And second, there are some religious holidays coming up. We have Easter, we have Ramadan, and we have Passover. And people tend to gather together as family and friends. So we really want to get that message out there. The weather's getting better as well. And so it's important that all of us know that we have to, first of all, follow the directives of health authorities, and second, do everything we can to rally to support others who are in difficult circumstances. So this is a very key time to do it. It's interesting that all 12 mayors are on site. Niagara Lake, by the way, had already declared, and the others have joined us today. So we think this is exceedingly important. It's a Niagara-wide effort, and we want to protect everybody. We want to protect those healthcare workers who work in the hospital and non-hospital situations. They're delivering healthcare. Our first responders and others in the community are doing their part to help out in these extenuating circumstances. So that's what we really want to do, and I think people are rallying to it. It's good to see that overwhelmingly people are complying with the suggestions and directives of the health authorities. There are a few who are not, and they have to be reminded they're not invincible, and they have the potential of spreading the disease to others and overwhelming our healthcare system if we don't follow the appropriate rules.
Why do you think that it takes a little bit longer for municipalities and the region to declare the state of emergency after the province had done it?
For a long period of time, what the province had done was fine, was very good, the appropriate step, and it would cover us. And we were looking for timing when we would, like you will have recognized in the last week and a half, everybody's been doing a lot of advertising, including the Niagara region and our individual municipalities doing getting the message out. But we knew at some time we would have to reinforce that. And so we held off in the declaration until such time as we recognized that we would need another push in the right direction, another directive to people, another suggestion as to how serious the situation was and what they could possibly do to help out.
What does this state of emergency allow municipalities in the region to do?
Well, there are some people who, as volunteers in these situations, become part of the effort working with the municipality. They are not covered by Workers' Safety Insurance Board provisions. They will be covered because of the emergency. So people aren't going to hesitate. They're going to say, they might hesitate otherwise and say, gee, if I get injured or I become ill as a result of this, I'm not covered, so perhaps I should be a bit reluctant. This allows a relief of that particular concern. It also empowers municipalities to make agreements with other councils or with other entities, such as people in the private sector. It makes special response agreements, as I say, with the non-government organizations and so on, and the use of outside emergency personnel. maybe getting some federal assistance, so that's part of it. So all of those are important, as well as protecting counselors and regional staff and city staff from liability if they are undertaking certain emergency actions. Doesn't mean that the municipality is totally exempt. It does mean those individuals are.
It's a historic time. I do believe that this has never happened.
That is absolutely correct, and it is great to see the rallying around. There's a lot of different views. Each of the mayors made a contribution to what exactly we should do, the message we should get out. I'm grateful to all of the mayors for this level of cooperation, and individually in their communities, they'll be sending out messages and talking about it as well. So this is a region-wide effort. It's everybody working together. It's exactly what we want to see, and the message is the same for all of us.
Thanks for joining us today, Jim.
Mike, good to be with you, and thank you to Cogeco, your TV, for providing this particular service, which I'm sure is very valuable to the people of the Niagara region.
Regional Chair Jim Bradley joining us here on The Source COVID-19 Niagara update, and the biggest update, of course, a region-wide state of emergency. We'll be right back.